let's get right into building your ultimate masterclass checklist for that very first visit to a trichologist. You know, if you're pulling way too much hair out of your brush and you're finally ready to call in the pros, you are in the perfect place. We're going to make sure you walk into that clinic armed, ready, and knowing exactly what questions to ask.
Think about it. Are you treating the symptom or the actual cause? I mean, so many of us literally drop a small fortune on fancy serums or thickening sprays the second we notice extra shedding, but we do it without ever finding out the real root cause. That's exactly where a trichologist, a specialist in scalp and hair health, steps in. But listen, to truly get the most out of their expertise, you've got to be an active, empowered participant in your own diagnosis. So to guarantee you get the absolute most out of your medical consultation, we're going to tackle 5 key steps today: preparing for your visit, uncovering the root cause, addressing your lifestyle and habits, navigating treatments and expectations, and finally, what we call the two-way street.
All right, kicking things off with step 1, preparing for your visit. Because believe it or not, a top-tier consultation actually begins weeks before you even open the clinic doors.
Get this, over 40% of people completely fail to spot hair damage until it literally snaps off. Crazy, right? That means early red flags like persistent dryness, dullness, or a part that's just slowly getting wider are incredibly crucial data points. You absolutely need to document these. Grab your phone, step into some natural light, and snap some clear photos of your parting from above. Maybe even count your shed hairs for a week. Doing this takes all the guesswork out of the equation for your specialist. Then, the day before your appointment, there are 3 golden rules. Step 1, wash your hair exactly 24 hours prior, not the morning of the visit. Step 2, absolutely no styling products, dry shampoos, or hair fibers. Why? Because your trichologist needs a completely clear, unfiltered look at your natural scalp environment, your sebaceous gland activity, and your real hair texture. And step 3, grab any blood work you've had done in the last 6 months and bring it along. Moving right along to step 2, uncovering the root cause. This is where we get into the absolute must-ask diagnostic questions you need to fire off right out of the gate. Your very first question should be, could there be multiple causes behind my hair loss? Don't just assume there's one single villain in this story. Ask your specialist to specifically break down if your shedding is driven by a combination of genetics, a hormonal shift, a recent illness, nutritional deficits, or maybe even an autoimmune response. Hair loss is super complex, and it's actually really common for 2 or 3 factors to pile up all at once. You also need to nail down exactly what category of loss you're facing. Are we talking temporary shedding, like telogen effluvium caused by major stress or a virus, which usually clears up once the trigger is gone? Or are you looking at long-term permanent pattern baldness, like androgenetic alopecia? Knowing the difference is a total game changer because it completely dictates your treatment plan. Don't leave that office without a clear answer on this. Next up, you have to ask, what specific blood test do you recommend? Our hair is incredibly sensitive to internal imbalances, so if your doctor doesn't automatically suggest checking what's going on under the hood, pushing for specific blood diagnostics is a 100% non-negotiable step for you as an empowered patient. You're looking to discuss essential tests for things like iron and ferritin, vitamin D, B12, thyroid, blood sugar, and sex hormones, because low iron can literally choke your follicles by depriving them of oxygen. And get this, uncontrolled blood sugar has recently been strongly linked to severe central scalp hair loss. Your thyroid and sex hormones like DHT and estrogen, they're the chemical messengers running your hair's life cycle. Remember, test, don't guess. Okay, on to step 3, addressing lifestyle and habits. Because your daily routine is either fiercely supporting your follicles or actively sabotaging them. I know it sounds a bit funny, but you should absolutely ask, is my go-to lunch or my daily styling routine messing with my hair? It's incredibly empowering to find out if your low-protein diet, your chronic stress levels at work, or even that super tight ponytail you throw your hair into every single morning are secretly aggravating your condition. A good trichologist is going to help you spot those hidden lifestyle triggers. They're looking for low protein and nutrient deficiencies, crazy daily stress levels, tight hairstyles, extreme heat, chemical treatments, or even washing your hair too much or too little for your specific scalp type. You really need to know if mechanical stress or nutritional gaps are weakening your hair shafts from the outside in. Otherwise, you're just fighting an uphill battle at home while paying a premium for clinical treatments. All right, so you've got your diagnosis and your lifestyle dialed in. Time for step 4, treatments and expectations. This is all about navigating the incredibly overwhelming world of hair loss therapies without getting taken advantage of. you absolutely must ask this exact question. What are my sustainable treatment options, and do they have scientific backing for my specific condition? Seriously, I can't stress this enough. There are countless stories of people dropping thousands on advanced therapies like PRP, platelet-rich plasma, only to find out later that it doesn't even work for their specific type of hair loss. Get evidence-based recommendations tailored to your diagnosis, not just the priciest package the clinic offers.
And hey, setting realistic expectations is absolutely vital here. Hair growth is a very, very slow process. It's not going to happen overnight. Month 1 is just about starting consistent treatment. By month 3, you might notice some initial changes and a bit less shedding. But fuller, natural regrowth, that takes anywhere from 6 to 12 months. You've got to mentally prepare for a long-term commitment, or you might end up quitting a treatment right before it actually starts working. Oh, and keep this number burned into your brain, 50 to 100. Remember, losing 50 to 100 hairs a day is a totally normal part of the human hair growth cycle. So please don't panic if you still see a few strands in your hairbrush or the shower drain while you're undergoing treatment. Which brings us to our final step, Section 5, the two-way street. We've covered the questions you need to ask, but now let's flip the script and look at the investigative questions your trichologist is going to ask you.
Look, a great specialist is going to grill you. And that's exactly what you want. They'll ask for a timeline of when the shedding started, recent life events, your current meds and supplements, family history of baldness, any signs of scalp inflammation like burning or itching, and your ultimate hair restoration goals. Be ready to detail your health over the last 6 months, because a lot of times your follicles respond to a stressful physical event like surgery or rapid weight loss with a massive delay of 2 to 4 months.
Then they're going to pair all your verbal history with actual physical exams. The gold standard here is a trichoscopy scan. It's totally painless, basically a magnifying camera for your scalp to map out the exact structural health of your follicles. They might also do a gentle pull test to gauge active shedding levels. And in rare cases, they might do a tiny scalp biopsy if they suspect permanent scarring alopecia or deep follicle damage.
And it all comes back to this one brilliant quote: hair loss is usually a symptom, not the diagnosis. The hair falling out, that's just your body's alarm bell ringing. True healing only starts when you look way beyond those hair strands to figure out what your internal body, your hormones, your diet, and your immune system are actually going through.
Which leaves us with this final, incredibly powerful question. So, what is your hair trying to tell you about your overall health? Well, I hope this structured checklist leaves you feeling totally prepared, empowered, and fired up to book that consultation, demand the right tests, find your true root cause, and finally, take back control of your hair wellness. Keep learning, keep asking those tough questions, and I'll catch you in the next explainer.